You've just been diagnosed with cancer and will soon be undergoing chemotherapy or immunotherapy treatments. The disease and its treatment may have physical, psychological, social, and financial repercussions. You will most likely have to make adjustments to your lifestyle and to your daily routine. This video is intended to foster dialogue among patients, their loved ones, and the members of their healthcare team. It will help you become more familiar with chemotherapy and more able to easily manage its side effects. It also includes practical advice on various aspects of your day-to-day life. Throughout the video, watch for the presence of icons. The icons will indicate whether the information transmitted concerns patients on chemotherapy alone, those on immunotherapy alone, or those receiving a combination of the two types of therapy. Chemotherapy is a type of cancer treatment. It attacks cancer cells almost everywhere they are found in your body. But chemotherapy may also attack healthy cells in your body and thus cause side effects. The healthy cells most likely to be affected are those that reproduce rapidly, cells in the blood, digestive tract, hair follicles, and in the reproductive system. However, these cells have the ability to reproduce within a short period of time. Some chemotherapy drugs are used on their own, but most often, several medications are given together at regular intervals. Chemotherapy may be combined with other types of therapies to attack cancer cells at different levels. Your physician will establish a chemotherapy treatment protocol that is based on your type of cancer and the stage of your disease. This protocol establishes the medications to be used, the number of treatments, and the intervals between them. For instance, once a week or once every 3 weeks. Your treatment can be used to induce the disease's remission, reduce the risk that the disease reappears, treat metastasis, slow down the disease evolution or progression, or relieve physical discomfort such as pain to enhance quality of life. The way in which chemotherapy medication is administered varies depending on the product used and the type of cancer. Chemotherapy can be administered orally, by injections of the medication under the skin, or by injections of the medication into the veins. There are other methods of administration, contingent on the patient's health status. Is the administration of chemotherapy painful? The administration of chemotherapy is usually painless when administered correctly into the veins. The nursing staff working in the chemotherapy center is trained to administer it safely. A persistent risk of accidental leak of medication out of the vein in the surrounding tissue remains, which could cause pain and damage to your skin or even more deeply. You will be asked to report any changes or burning sensations to your nurse, even if they seem unimportant to you. Some chemotherapy medication may cause different reactions during the administration, like sudden fever, difficulty breathing, hypotension, redness, or itching. During the administration, the nursing staff will provide close monitoring and ask you to report any changes in your health status as quickly as possible to offer the best care and for better comfort. You may also be given medication to prevent these reactions. Side effects are the result of, among other things, changes to healthy cells caused by the medication. Adverse effects are usually of short duration, different depending on the treatment, also different depending on your overall state of health, and they progressively disappear. The side effects likely to occur during your treatment will be explained to you by your healthcare team. You'll be informed of the actions to be taken in order to prevent or relieve these discomforts. Immunotherapy is a type of treatment against cancer which doesn't work like chemotherapy. Whereas chemotherapy works by attacking directly cancer cells, immunotherapy acts by teaching your immune system how to fight cancer. Immunotherapy may be given alone or combined with chemotherapy. The overactivation of the immune system by immunotherapy can sometimes lead to inflammation of one or more organs, which can manifest in different ways anywhere in the body. Pay attention to any new symptoms and make sure to talk about those with your healthcare team on your next appointment or even before if needed. The following symptoms may be caused by immunotherapy: persistent fatigue, weakness, stiffness or muscular and articular pain, unusual headaches, dizziness, changes in behavior, abdominal pain, diarrhea, itching or rash, and difficulty breathing. These effects are usually light in intensity, but are important to report to the healthcare team. In some rare cases, they may be more serious and require professional health interventions. If you're receiving immunotherapy alone, you shouldn't be affected by the usual chemotherapy side effects such as nausea, drop in blood cells, hair loss, or mouth sores. Nonetheless, since your immune system will be busy fighting your cancer, you may be at risk of getting infections. If you have infection symptoms or persisting fever, please contact your healthcare team or go to the emergency. Unless you're treated with a combination of immunotherapy and chemotherapy, you don't have to follow any protective instructions concerning the handling of your urine, stools, or other body fluids, since immunotherapy is not dangerous to your relatives. This section presents information on the most prevalent adverse effects caused by chemotherapy. Please note that you will not experience all of the adverse effects described. Blood cells, including red blood cells, white blood cells, and platelets, are made in the bone marrow. Chemotherapy works at the level of the bone marrow and may cause a decrease in the production of these blood cells. The magnitude of such a reduction varies depending on the treatment. This reduction is monitored through blood tests. Should there be too significant a decline in the amount of blood cells, changes may be made to your chemotherapy treatment. White blood cells are immune system cells that defend the body from viruses and destroy bacteria. A number of chemotherapy treatments cause a reduction in white blood cells, which is called neutropenia. When this happens, you are most likely to get an infection. The amount of white blood cell rises gradually between treatments, naturally. What signs of infection should I watch for? Fever, chills, and cold or flu symptoms, major diarrhea, which means more than 3 bowel movements per day, throat irritation, coughing, secretions, difficulty urinating or burning sensation when urinating, blood in the urine, redness or swelling on the body, unusual pain. What can I do to prevent infection? Avoid contact with people who have an infection like the flu, a cold, gastroenteritis, or any other contagious disease. If this proves impossible, wash your hands often. Carefully wash your hands, especially before every meal and after having used the bathroom. Avoid contact with animal excrement like litter, stools, or urine. If you must handle animal excrement, wear a mask and wash your hands immediately afterwards. Be vigilant. Watch out for fever. It's dangerous to stay home with a fever. If you have a temperature of 38 degrees that lasts more than an hour, if you have a temperature of 38.3 degrees or higher, or if you have severe chills, go to the emergency immediately. When you arrive at the emergency, put on a mask, tell the triage nurse that you are currently undergoing cancer treatment and that you have a fever. Do not take acetaminophen like Tylenol, or ibuprofen, such as Advil or Motrin, before seeing a doctor in the emergency because these drugs can mask or lower your fever. You must be assessed by an emergency physician and have the necessary tests to screen for infection. Platelets play a role in blood coagulation to stop bleeding. An insufficient number of platelets in your blood will increase the risk of bleeding more easily and for longer periods of time. What signs should I watch for? Appearance of tiny red spots or bruises on the skin. Prolonged bleeding following a superficial cut or scratch. Nosebleeds for no reason. What can I do to prevent injuries or bleeding during this time? Use an electric razor rather than a razor with blades. Opt not to use dental floss. Apply firm pressure for 5 to 10 minutes to stop the bleeding if you have a cut, and, if possible, keep the injured part in an elevated position. Avoid taking medications that contain aspirin or ibuprofen because these drugs thin the blood. Take acetaminophen as needed, but before taking it, make sure you don't have a fever. What do I do if I have a nosebleed? Keep your head upright. Apply firm, continuous pressure to the nostrils under the bridge of your nose. If this method does not work, apply ice to the bridge of your nose and to the nape of your neck. Some chemotherapy medication may cause nausea or vomiting. Nausea may occur right after the chemotherapy session, several hours or even several days later. Some people may experience nausea before their treatment because they're anxious or fearful of vomiting. There are several ways to prevent or control these discomforts. Drugs to manage nausea will be prescribed to you. It's easier to prevent nausea than to treat it once it has begun. It is therefore important to take the drugs according to the instructions given. Sometimes, several types of anti-nausea drugs must be taken to get relief. What steps can I take to prevent nausea and vomiting? Eat light meals on treatment days. Relax before meals. Avoid foods that are fatty, fried, spicy, or overly sweet. Those with strong odors and those whose odor during cooking bothers you. Snack on dry foods like crackers, toast, and dry cereal. What steps can I take if I vomit? Rinse your mouth with water to which salt or lemon juice has been added. Start to eat again 30 minutes to 1 hour after vomiting. Start drinking liquids again gradually, increasing the amount according to your tolerance level. Take your anti-nausea medication again if the vomiting occurred within the first 30 minutes after you took the medication orally. Inform the care team if the vomiting lasts more than 24 hours despite having taken the prescribed medication. Diarrhea is the elimination of liquid or soft stool. It is caused by the inability of the intestines to retain water. Some chemotherapy treatments irritate the intestinal mucosa and cause diarrhea. What to do if you have diarrhea? Limit your consumption of fried, fatty, spicy, or overly sweet foods. Avoid foods that are naturally laxatives such as prunes, caffeine, or alcohol. Choose foods low in fiber such as white bread, cookies, and canned fruits and vegetables, and consume refined starches like white pasta and white rice. And drink plenty of fluids to prevent dehydration. Consult without delay if you're having diarrhea for 24 to 48 hours without improvement despite measures taken, or if you're undergoing immunotherapy. The cells inside your mouth may be affected by chemotherapy. The symptoms may progress from inflammation of the oral mucous membrane, such as the cheeks, tongue, and gums, to small sores, which we call ulcers. Usually, symptoms improve naturally within 1 to 2 weeks. It's very important to pay special attention to mouth care during treatment. What steps can I take to prevent sores? Brush your teeth with a soft bristled toothbrush after every meal and at bedtime. Avoid using dental floss if you experience bleeding or pain. Avoid alcohol-based mouthwashes. Gargle with the homemade solution. The recipe is found in the information guide for patients and their loved ones. What steps can I take if I get sores? Avoid drinking alcohol and smoking. Avoid foods that are very hot, acidic, spicy, or seasoned with vinegar that risk irritating your mouth. Choose foods that are moist, soft, and easy to chew and swallow. Eat icy cold foods to soothe your ulcers. Wear well-adjusted dentures, clean them regularly, and remove them often to give your gums a rest. Gargle with the homemade solution. Some chemotherapy treatments may cause hair loss or make hair sparser. Some targeted therapies may cause the hair to become finer or drier. Hair loss is often temporary and usually begins 2 or 3 weeks after starting treatments. Hair loss may be gradual, sudden, or in clumps. The scalp is often sensitive to the touch. Hair usually grows back 6 to 8 weeks after the end of the treatment. It may, however, have a slightly different color or texture. What steps can I take to prevent hair loss? Hair loss can sometimes be unavoidable depending on the treatment given. Treat your hair gently. Use a soft bristle brush. Wash your hair with mild shampoo every 4 to 7 days. Gently towel dry your hair. Let your hair dry naturally or use a blow dryer at low temperature. Avoid coloring when possible, otherwise ask your hairdresser or colorist to use softer products to avoid irritating your scalp. Consult a wig maker before your hair starts to fall out. This will make it easier to choose a wig style and color that closely resemble your usual hairdo. You can use turbans, scarves, and hats to conceal hair loss. Such accessories can be elegant and attractive when matched with your clothes. Certain treatments may cause temporary changes to your skin. What are the possible changes? Rash, redness, itching, dryness, or increased sensitivity to the sun and tanning lamps. What steps can I take to prevent these changes? Use an unscented body cleanser and moisturizing lotion. Protect your skin from the sun. Cover your arms and legs. Wear a large brimmed hat. Apply sunscreen with a sun protection factor of at least 30 in every season. Avoid prolonged exposure to the sun. Refrain from swimming in water containing lots of chlorine. Protect your skin from heat sources such as heating pads or tanning lamps. Refrain from rubbing and scratching the skin. Consult without delay if the rash is severe or widespread, or if you're undergoing immunotherapy. In an agenda or a calendar, or in your oncology passport, note your upcoming treatments, appointments, tests, and the professionals you meet. Keep this reference information and the documentation you are given in a single location like a binder or a pouch. This way, you can find the information quickly when a need arises. There is no specific diet to follow during chemotherapy treatment. However, adhering to a varied, healthy diet is advised because your body needs all types of nutrients for its growth, maintenance, and repairs. You may lose your appetite during your treatment. Some chemotherapy drugs may alter your sense of taste and smell. This can make food less appetizing and give them a more bitter, salty, or metallic taste. Drinking plenty of fluids is just as important as a good diet. Drinking lots of water is recommended to help the kidneys eliminate the toxic products produced by the destruction of cancer cells. Although it is preferable that you avoid alcohol, drinking a small quantity is usually considered safe and will not affect the effectiveness of the treatment. A healthy diet adapted to your condition will enable you to maintain your weight, to better cope with the adverse side effects of treatment, to repair tissues damaged by surgery, radiation therapy, or chemotherapy, to strengthen your defenses against infection, and to improve your well-being and quality of life. Can I eat all foods? Yes. However, we recommend that you favor the following products: pasteurized products, certified inspected meat, cooked meat, chicken, fish, seafood and eggs, and washed fruits and vegetables. Should I refrain from eating or drinking certain products? Yes. We recommend that you avoid the following products and locations: sushi and raw fish, bulk products, cold cuts, probiotic concentrates and products containing them, dairy products packaged at the counter, green tea, dairy bars, salad bars, and buffets. What step can I take if I have no appetite or to hide bad tastes? Eat when you're hungry. Have several small meals every day, including nutritious snacks high in calories and protein like nuts or soft bars. Cook in larger quantities on days when you're feeling well, and freeze food in individual portions for days when you don't feel like cooking. Eat foods that are cold or at room temperature to weaken odor and tastes that are too strong. Mask unpleasant tastes. If you do not have mouth sores, eliminate any aftertaste by drinking orange or cranberry juice or lemon-flavored water. Season your food. Eat candy or chew sugarless gum. In the event of a metallic taste, use plastic utensils. If the situation persists, consulting the nutritionist may prove helpful. A pharmacist will analyze your pharmacological record, including taking over-the-counter medications and natural health products before starting your treatment, but not before each clinic visit. Tell us if you start any new medication, natural product, or vaccine while you're in treatment. This will help prevent any drug interaction. Can you use natural products or medicinal plants? No. You must first talk about it with the oncology pharmacist. Natural products, such as vitamin supplements or glucosamine, often contain extracts from a number of different plants. Taking natural products during chemotherapy treatments may cause problems, such as a reaction to your chemotherapy, a reduction in effectiveness, or an increase in side effects. Fatigue, stress, and emotions. Fatigue is a temporary symptom, and experiencing it does not mean that the disease has worsened or that the treatment has failed. This state of fatigue changes your quality of life, reduces your capacity to do your daily routine, and can make you more irritable and cause difficulty concentrating. Despite getting lots of rest, you may still feel fatigued. Since the announcement of your illness, you've been going through a range of emotion, and it is quite normal. However, if your emotions fluctuate a great deal, and if this interferes with your daily routine, it's important that you discuss it with someone to get help. The symptoms of stress and anxiety can be quite serious at times and alter your quality of life. What can I do to manage my emotions, my stress, and my fatigue? Some approaches like meditation, deep breathing, and visualization may help you relax. Psychosocial and psychological help is part of the care and services offered that could help you. Plan your activities in such a way as to conserve your energy. Perform the least demanding tasks. Divide your physical activities 10 minutes 3 times a day instead of 30 minutes at one time when you feel that your energy level is low. Ask for help to do tasks that require a lot of effort or those that tire you the most while keeping an activity level as close to your habits as possible. Avoid resting too much. Too much rest is not good for this kind of fatigue. It can even make the feeling of fatigue worse. Physical activity is encouraged. Start slowly and progress slowly. Your body will need a few days to eliminate the chemotherapy medication. Most of the drugs will be eliminated by your kidneys or liver. For about 4 days after completing a treatment, some of them will find their way into your body fluids, meaning your urine, stools, and vomit. If you're only receiving immunotherapy, you do not need to take precautions with body fluids. What precautions must be taken regarding my body fluids? During the first 4 days following a chemotherapy treatment, urinate from a seated position to avoid splashing. Put down the lid of the toilet seat after each use. Flush the toilet twice consecutively. Regularly clean the edge and outside of the toilet bowl and the floor around the toilet. In the event of vomiting or incontinence, wear gloves when cleaning up. Wash sheets and linens separately only if they have been soiled with your body fluids. Wash your hands after contact with your body fluids or after having touched a surface that has been in contact with your body fluids. Pregnant and breastfeeding women must not handle your body fluids. Work and financial situation. Check with your insurance company soon after your cancer diagnosis to determine the compensation you are eligible for. If you're experiencing financial difficulties, a consultation with a social worker may be offered to help you cope with this situation and reduce any anxiety. Can I continue to work during my chemotherapy treatment? The decision to stop working will depend on various factors such as the type of treatment you will be undergoing, the adverse side effects of the treatment and their intensity, the type of job you have and the flexibility of your schedule, and your financial needs. Treatment doesn't compromise your ability to maintain your sex life. However, some medical conditions may require that you refrain from having sexual relations. Is it normal not to feel the desire to have sex? Yes, it's absolutely normal. Anxiety relating to the disease, fatigue, or physical discomfort may result in a temporary decline in sexual desire. Don't hesitate to discuss this with your partner. You may also need to meet the sexologist from the interdisciplinary team, if needed. For women, hormonal changes induced by the chemotherapy may cause vaginal dryness, a burning feeling, or itchiness. If you have pain during intercourse, use a water-based vaginal lubricant. Since the amount of blood platelets may decline due to chemotherapy, light vaginal bleeding may occur after intercourse. Wearing a condom is recommended the first 4 days after a chemotherapy treatment because there will be traces of the drugs in the sperm or vaginal secretions. Is it dangerous to become pregnant during a chemotherapy treatment? Men and women of reproductive age must use a mechanical method of birth control such as a diaphragm or condoms. A child should not be conceived during treatment period because chemotherapy may be harmful to fetal development. Can I begin or continue renovation work while I'm undergoing chemotherapy treatment? Refrain from carrying out renovation work while you're having chemotherapy treatment because there's a possibility that fungi will be released into the air even if the material being used is new. Can I keep my pet in the house even if I'm having chemotherapy treatment? Your pet may stay in the house during your treatment. You can continue doing your activities with it. However, wait until the end of your treatment before introducing a new pet into your home. Engaging in physical activity and daily routine activities are helpful because they prevent and mitigate the adverse effects of chemotherapy, help you maintain a good quality of life, and enable you to keep your muscles stronger, which reduces the risk of falls. May I start or continue a physical activity while I'm undergoing treatment? If you're in the habit of engaging in recreational activities, outings, or physical exercise, you may continue to do so. You may also begin an activity or exercise program as long as you respect your physical condition and your limitations. May I garden if I'm undergoing treatment? You may garden under certain conditions. Do not touch soil or sand needlessly due to the presence of fungi and other germs, and wear gloves and a mask to garden, and do not touch mold. May I swim in a pool, a lake, or the ocean if I'm undergoing treatment? Refrain from swimming in public pools or public spas and lakes because they contain more bacteria. On the other hand, private pools and beaches on the ocean are suitable locations for swimming. To become more knowledgeable of your situation, do not hesitate to share your concerns with someone on your care team. The staff at the Chemotherapy Center and Care Unit is available and wishes to offer you the best possible care.